Squatting is a fundamental movement pattern that can be loaded and performed in many different ways to improve overall function and performance. But we never want to add load on top of dysfunction. This is often when injuries occur. Prior to loading up a barbell and squatting, we should make sure we have a couple boxes checked on some very important key prerequisites. We're going to use the ankle to wall test. Without shoes, your big toes should be about 4 inches from the wall. While keeping your foot in full contact with the ground, attempt to touch your knee to the wall. If your knee touches the wall while maintaining complete contact with your foot in the ground, you have sufficient dorsiflexion to begin squatting. If you are unable to touch your knee to the wall while maintaining complete contact with your foot and the ground, if you feel a pinching sensation in the front of your ankle, that could indicate a joint restriction. If you're unable to touch your knee to the wall and you feel tightness in the back of your leg, that could indicate a soft tissue restriction. For a joint restriction, you're going to use a band to perform a joint mobilization. Start by anchoring a band to a wall. Next, place your foot inside of the band on a slightly elevated surface. Loop the band around your ankle. The top of the band should be level with the front crease of your ankle. Make sure there's plenty of tension on the band, and while keeping your foot in complete contact with the ground, push your knee forward. Hold for about 5 seconds, lean back, and repeat 5 to 7 times each leg. For a soft tissue restriction, you're going to stretch your gastroc soleus complex by placing your heel as close to the wall or another upright surface as you can. And while keeping your legs straight, lean forward and hold that position for 2 sets of 30 seconds. Next, bend your knees slightly and lean a little bit further forward and hold that position for 2 sets of 30 seconds. This will stretch your gastroc and your soleus, that deeper muscle inside your calf. The next area that is important to check for sufficient mobility is the hip joint. Starting by sitting on the ground with your hips and knees at 90 degrees. 90 degrees at the hips and 90 degrees at the knee. Sit in this position for 30 seconds, maintaining an upright posture, and then, while keeping your feet in full contact with the ground, rotate to the opposite side. If you feel tightness on the inside of your hip on the same side as your back leg, that could indicate possible limitation in your hip internal rotation. If you feel tightness on the outside of your hip in your front leg, that could indicate a possible limitation in your hip external rotation. To improve this, with your hip internally rotated, use a dowel to leverage your back leg into an internally rotated position. Hold this for several seconds and repeat 3 to 5 times. To improve hip external rotation, grab a box or a bench to perform a hip rotator stretch. Hold this position for 2 sets of 30 seconds on each side. The last key area that we should check for adequate mobility is the thoracic spine. Most people lack sufficient thoracic extension to stay upright in a squat. To perform this test, stand with your heels about 2 inches away from the wall, your low back and upper back in full contact with the wall. Place your arms in a 90-90 position, and then while maintaining full contact with your back and your arms, press your arms above your head. If you are unable to keep your low back in full contact with the wall, this can indicate a lack of mobility in your thoracic spine and extension. To improve thoracic extension, you can kneel with your elbows on a bench and then press your chest and stomach towards the ground. You want to hold this position for 2 sets of 30 seconds or repeat the test for 3 to 5 reps to improve thoracic extension. Now we're going to start with basic squat technique. We're going to start with our feet below our shoulder width, toes pointed slightly forward or slightly out. We want to maintain a tripod foot position. This means we want to maintain 3 points of contact with our feet and the ground. On the outside of our foot, on the inside next to the ball of our big toe, and our heels. Now we're going to sit back into our hips while keeping our chest up, maintaining a neutral spine, and gazing at the ground 6 to 8 feet in front of you. As you squat down, focus on pushing your knees out as you sit lower into the squat. If you lack proper ankle dorsiflexion, try placing a 5 to 10 pound plate under each heel, which should allow you to sit in a more upright position and deeper into the squat. For the high bar back squat, we're going to start with the barbell directly across the top of our shoulders. In this position, we can have a narrow or a wide foot stance, We want to maintain a neutral spine and upright posture, which will place more emphasis on our lumbar paraspinals and our quads. Next squat variation is going to be the low bar back squat. Pull yourself under the bar, retracting your shoulder blades. In comparison to the high bar squat, the barbell should be sitting 2 to 3 inches lower across the top of your shoulder blades. With your chest slightly angled forward, sit back into the squat as if you're sitting into a chair. This variation will place more emphasis on the glutes and the hamstrings. The next squat variation is going to be the front squat. The barbell will be in a front rack position. The bar should be placed against your neck and across the top of both shoulders. While maintaining a high elbow position and your chest up, perform the movement. The position of the barbell will place more emphasis on your core and your quads during this variation. The final squat variation is going to be the Berserker Squat. Place the barbell across the crease of your arms, keeping your hands high and your elbows close to your body. Squat till the bar contacts your thighs and then come up. This barbell position will place more emphasis on your core, your low back, and your hamstrings. Keep in mind that it is important to change our movement patterns periodically. Any repetitive movement eventually leads to overuse injuries and breakdown. Different squat variations place different emphasis on different muscle groups to make sure that we are well-rounded, developed athletes. If you have any questions or concerns, please feel free to leave us a comment or reach out to your injury prevention specialist.